All right. The other pox virus that we are going to talk about is not really talked much about in your textbook because I think what we're dealing with is more of an emerging infectious disease. So the virus was previously called monkeypox, but that name is not terribly accurate because it's not a monkey pox virus. Monkeys aren't the major host. Actually, rodents tend to be. But also, people were using the name monkeypox I'm trying to think of the nicest way to say this, but they were basically being racist. Monkeypox virus, formerly known as monkeypox virus, tends to emerge infrequently from sub-Saharan Africa. And so people were using the term monkeypox pejoratively with racist connotations. And so the World Health Organization recommended renaming the virus to Mpox. So Mpox is a zoonotic infection. It comes from animals, not monkeys. They're not the main host or the main reservoir. Rodents are. The symptoms of Mpox are similar to smallpox, though they do tend to be a little bit more mild. In patients who have Mpox, they will often develop swollen glands, and that can help differentiate from some of the other similar looking conditions. So we've already talked about chickenpox, which even though it's called chickenpox is not a pox virus, it's a herpes virus that can cause a full body rash. We'll talk about measles, which can also cause a full body rash. But the Mpox, you'll see those swollen glands. There was a previous outbreak in the US in 2003 that was associated with pet prairie dogs. I did not know that there was a pet prairie dog trade, but apparently there is. And these pet prairie dogs had been in contact in some way with Gambian giant rats. And there were 71 patients who developed Mpox. And this is kind of where your textbook leaves off. So here are pictures of patients who have Mpox. You can see that the density of the lesions is not as significant as we see with smallpox. So why am I bringing up Mpox again when it's not really described that much in your textbook? Well, because, I don't know if this was on anybody's, 2020 end of the world bingo card. We had one pandemic. And then we had giant hornets, and now we have Mpox. So the first case in 2022 was detected in early May. It was a patient from the UK who had recently traveled to Nigeria, developed a rash on April 29th, flew to the UK on May 4th, and was diagnosed on May 6th as having Mpox. I just checked the data a couple days ago, so, mid-March of 2023, not even a year after the outbreak started. And cases have now been confirmed in 110 countries. Fortunately, Mpox is less transmissible than smallpox. Smallpox was a very highly transmissible respiratory pathogen, whereas Mpox is less transmissible and does require close contact. Without any sort of treatment, the mortality rate during this outbreak has kind of hovered between 1% and 3%. With treatment, even lower. So as of March 15th, 2023, those were the most recent data I could pull from the CDC. There were 86,500 confirmed cases total, with 111 deaths. So that's less than 1%. In the United States, the US has had the highest burden of infection. There have been over 30,000 cases and 38 deaths. This is a map from the CDC showing all of the countries that have had diagnosed Mpox infections. The size of the circle is representative of the number of cases. The circles in blue represent countries where Mpox is endemic. So all of the countries in orange have never had Mpox cases like this before. Mpox, again, endemic to kind of Western Africa, but it has now spread across the globe. In the US, Mpox has been found in every state and territory. The darker the shade of blue, the more cases. As you might imagine, some of our more populous states have more cases. There are 2 licensed vaccines that are being given to at-risk populations. One is a non-replicating vaccinia strain virus. The other is a live attenuated vaccinia. You should probably think about if you're going into healthcare and you're wanting to reach populations and get them vaccinated against Mpox, which vaccine would you pick for your various patients? So any that are immune compromised, you might want to pick one over the other, and that's something that you can think about. These vaccines are also vaccines. The reason that there is a vaccine for Mpox already is because these are smallpox vaccines. So any patient who has now been vaccinated against Mpox theoretically should be vaccinated against smallpox as well. Because there is a relatively long incubation period, patients who have been exposed or may have come into contact with an Mpox patient could receive post-exposure prophylaxis that could prevent development of symptoms just at all. So, if somebody that you had close contact with calls you and says, hey, I know we hung out a couple days ago, I've got Mpox, go get the vaccine. If the vaccine or post-exposure prophylaxis is taken between 4 and 14 days after exposure, it may not prevent symptoms from developing, but could certainly reduce the severity. So the earlier after exposure that the vaccine is given, the better. And clinicians are attempting to reach at-risk populations. So because it requires close contact, we're talking about people who are engaging in, most often, it's not a sexually transmitted infection, but we're seeing it in populations that engage in sexual behaviors like outside of a monogamous relationship. So that's considered to be kind of the at-risk population. These data are from Wikipedia, but it's the best I could find about the number of smallpox vaccines that are available worldwide. So these are the stockpiles. So the World Health Organization in 2018 had 27 million doses, France 55, Germany 100 million, the US 185 million. So there are a lot of vaccines available out there. It took a little bit for the FDA and other regulatory agencies to recommend vaccinating people against Mpox because we were tapping into our smallpox stockpile. But those vaccines can also be resynthesized. There is a general pox virus treatment because pox viruses carry their own DNA polymerase. There is a DNA polymerase inhibitor that will work against them because our DNA polymerase is different from the pox virus DNA polymerase. Other antivirals might work as well. So if a patient has already developed symptoms, it's too late to give them the vaccine. There are some antiviral therapies that can also help reduce severity or decrease the duration of the infection.